Question 1. What is the primary role of an RBT in the behavior change process? A. To diagnose developmental disorders. B. To design comprehensive behavior intervention plans. C. To implement skill acquisition and behavior reduction plans under supervision. D. To conduct independent functional behavior assessments. Answer: C. To implement skill acquisition and behavior reduction plans under supervision. This question asks about the main job of an RBT. The key phrase primary role highlights the core responsibility. RBTs are frontline staff who work directly with clients, putting the plans created by their supervisor, BCBA or BCABA, into action. These plans cover both teaching new skills, skill acquisition, and decreasing challenging behaviors, behavior reduction. RBTs do not diagnose, design plans, or conduct independent assessments. They are the ones who carry out the procedures based on the supervisor's instructions. Think of yourself as the expert technician who executes the plan built by the lead engineer, your supervisor. Your main focus is accurate and consistent implementation. Question 2. In the ABC model, the A stands for A. Action. B. Antecedent. C. Analysis. D. Assessment. Answer: B. Antecedent. This question tests your knowledge of the fundamental ABC model used in behavior analysis. This model is a way to understand why a behavior is happening by looking at what happens around it. The A in ABC stands for antecedent, which is the event, cue, or stimulus that occurs immediately before the behavior. The B is the behavior itself, what the person does or says, and the C is the consequence, what happens immediately after the behavior. The antecedent sets the stage for the behavior to occur. Remember, A comes before B in the sequence. Question 3. If a behavior is followed by a desirable consequence, and that behavior is more likely to occur in the future, this is called A. Punishment. B. Extinction. C. Reinforcement. D. Prompting. Answer: C. Reinforcement. This question asks about a core principle of learning in ABA. The key is the consequence making the behavior happen more likely in the future. Reinforcement is any consequence that increases the future probability of the behavior it follows. Punishment makes behavior less likely. Extinction is withholding reinforcement to decrease behavior. Prompting happens before the behavior to help it occur. If the outcome makes the behavior stronger, it's reinforcement. Question 4. What type of data collection involves simply counting the number of times a specific behavior occurs within an observation period? A. Duration. B. Latency. C. Frequency. Count. D. Interval recording. Answer: C. Frequency. Count. This question asks about a basic measurement method. Frequency, also called count, is the direct tally of every instance of the behavior during the time you are watching. Duration measures how long the behavior lasts. Latency measures the time from a cue to the start of the behavior. Interval recording involves marking if the behavior happens within specific time blocks. If you're just counting how many times something happens, you're measuring its frequency. Just make a tally mark for each occurrence. Question 5. What is the main goal of conducting a preference assessment? A. To teach new skills. B. To identify items or activities that may function as reinforcers. C. To decrease challenging behaviors. D. To determine the function of challenging behaviors. Answer: B. To identify items or activities that may function as reinforcers. This question is about an assessment tool used to find motivators. The purpose of a preference assessment is to figure out what a client likes and might be motivated to work for. Knowing their preferences helps the team choose effective reinforcers, rewards, that can be used to encourage desired behaviors and make learning fun. It's not designed to teach skills, reduce problem behaviors, or find the why behind challenging behaviors. That's an FBA. Preference assessments are all about discovering potential motivators. Question 6. When teaching a new skill, providing extra help before the client responds to increase the likelihood of a correct response is called A. Fading, B. Reinforcement, C. Prompting, D. Shaping. Answer: C. Prompting. This question asks for the term for giving assistance during teaching. A prompt is a cue or a form of assistance delivered before the client's response to increase the chance that they will respond correctly. This allows them to receive reinforcement for the correct response. Fading is reducing prompts over time. Reinforcement happens after the behavior. Shaping reinforces closer approximations to a target behavior. Prompts are like hints to help the client get it right. Question 7. In the ABC model, the C stands for A. Choice, B. Consequence, C. Cue, D. Criteria. Answer: B. Consequence. This question again tests your knowledge of the ABC model, focusing on the third part. The C stands for consequence, which is the environmental event that occurs immediately after the behavior. The consequence is very important because it's what influences whether the behavior is likely to happen again in the future. Understanding the consequence is key to understanding the function of a behavior. A consequence follows the behavior in the sequence. Question 8. If a behavior is followed by the removal of an unpleasant consequence, and that behavior is more likely to occur in the future, this is called A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer: B. Negative reinforcement. This question asks about a principle that increases behavior by taking something away. The key clues are followed by the removal of an unpleasant consequence. Something bad is taken away, negative, and behavior is more likely to occur in the future. The behavior gets stronger, reinforcement. When a behavior allows the person to escape or avoid something aversive, and this makes the behavior more likely, it's negative reinforcement. Positive reinforcement adds something good. Punishment decreases behavior. If a child says, "break please," during a difficult task, and the task is removed, unpleasant removity, and they say, "break please," more often in the future, that's negative reinforcement. Question 9. What type of data collection measures the time from the start of a behavior until it ends? A. Frequency, B. Duration, C. Latency, D. Inter-response time, IRT. Answer: B. Duration. This question asks about measuring how long a behavior occurs. Duration is the measurement of the total time a behavior lasts from its beginning to its end. Frequency is counting how many times it happens. Latency is the time from a cue to the start of the behavior. Inter-response time is the time between two instances of the same behavior. If you want to know how long a tantrum or a play activity lasted, you measure its duration. Question 10. If a behavior is followed by a consequence that makes it less likely to occur in the future, this is called A. Reinforcement, B. Extinction, C. Prompting, D. Punishment. Answer: D. Punishment. This question asks about a principle that decreases behavior. The key phrase is "makes it less likely to occur in the future." Any consequence that follows a behavior and reduces its future probability is called punishment. Reinforcement increases behavior. Extinction is withholding reinforcement to decrease behavior. Prompting happens before the behavior. Punishment weakens the behavior. Question 11. When teaching a complex skill by breaking it into smaller steps and teaching those steps in a specific order, this is called A. Shaping, B. Generalization, C. Chaining, D. Discrimination. Answer: C. Chaining. This question asks about a method for teaching multi-step skills. Chaining is a procedure used to teach a sequence of behaviors, the steps of a task analysis. where each step serves as a cue for the next, and reinforcement is delivered upon completion of the chain or parts of it being taught. Shaping reinforces approximations of a single behavior. Generalization is performing skills in new settings. Discrimination is telling stimuli apart. When you teach a sequence of steps to complete a task, you're using chaining. Question 12. What is the main reason for using objective behavioral definitions? A. To make data collection faster. B. To ensure different observers measure the behavior consistently. C. To understand the client's feelings. D. To satisfy parents. Answer. B. To ensure different observers measure the behavior consistently. This question emphasizes the importance of defining behavior clearly. An objective definition describes the behavior in observable and measurable terms, what it looks and sounds like, so that anyone observing the client would agree on whether or not the behavior occurred. This consistency in measurement across different RBTs is crucial for collecting reliable data that accurately reflects the client's behavior change over time. It's about making sure everyone is counting the same thing. Question 13. If a behavior occurs less often in the future because a desirable item was removed immediately after the behavior, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. D. Negative punishment. This question asks about a principle that decreases behavior by taking something away. The clues are less often in the future, punishment, and a desirable item was removed immediately after, negative. When something the client likes is taken away as a consequence and the behavior decreases, it's negative punishment. Taking away a toy because a child screamed and the screaming decreases is negative punishment. Question 14. What is the ethical responsibility of the RBT regarding client confidentiality? A. Discussing client progress with their family members. B. Sharing client information with authorized individuals on the treatment team. C. Discussing challenging behaviors with colleagues at a different company. D. Leaving client documentation visible in a public space. Answer. B. Sharing client information with authorized individuals on the treatment team. This question asks about your duty to protect client privacy. Confidentiality means keeping client information private and only sharing it with individuals who are authorized members of the client's treatment team and have a professional need to know. This includes your supervisor and other RBTs from your agency working on the same case. Discussing with just any family member, A, needs authorization. Unauthorized colleagues, C, or in public, D, or violations of confidentiality. Share client information only with those directly involved in their care. Question 15. When teaching a new skill using discrete trial training, DTT, what should happen immediately after the client provides a correct response? A. Present the next instruction, SD. B. Provide a prompt. C. Deliver reinforcement. D. Record data. Answer. C. Deliver reinforcement. This question walks through the steps of a discrete trial. In DTT, after the RBT presents the discriminative stimulus, SD, and the client makes a correct response, the immediate next step is to deliver the consequence, which for a correct response is typically reinforcement. The next est is presented later. Prompts come before the response, and data is recorded during the intertrial interval. Reinforcement immediately follows the correct behavior to strengthen it. Give the reward right after they get it right. Question 16. What is the difference between a primary reinforcer and a conditioned secondary reinforcer? A. Primary reinforcers are learned. Conditioned reinforcers are biological. B. Primary reinforcers meet biological needs. Conditioned reinforcers are learned through pairing with other reinforcers. C. Primary reinforcers are social. Conditioned reinforcers are tangible. D. Primary reinforcers are used first. Conditioned reinforcers are used later. Answer. B. Primary reinforcers meet biological needs. Conditioned reinforcers are learned through pairing with other reinforcers. This question asks you to distinguish between two types of reinforcers. Primary, or unconditioned, reinforcers are naturally reinforcing because they satisfy biological needs like food, water, sleep, and don't require prior learning. Conditioned, or secondary, reinforcers gain their reinforcing value by being consistently paired with primary reinforcers or other already established conditioned reinforcers, like praise, tokens, stickers. Praise isn't inherently reinforcing, but if it's paired with snacks, it becomes reinforcing. Primary reinforcers are natural, conditioned reinforcers are learned. Question 17. When conducting a functional behavior assessment, FBA, what is the main information the FBA aims to identify? A. The client's diagnosis. B. The skills the client needs to learn. C. The environmental events that maintain the challenging behavior, the function. D. The best way to punish the behavior. Answer: C. The environmental events that maintain the challenging behavior, the function. This question asks about the core output of an FBA. A functional behavior assessment is a process used to understand why a challenging behavior is happening. It aims to identify the function of the behavior, what payoff the behavior gets for the individual, attention, escape, access to tangibles, automatic reinforcement, by analyzing the antecedents and consequences surrounding it. While it can inform decisions about skills to teach or interventions, its primary goal is to identify the function. Figuring out the why helps us plan the how to help the client. Question 18. What is the ethical principle that requires RBTs to avoid causing harm to the client? A. Beneficence. B. Non-maleficence. C. Integrity. D. Justice. Answer: B. Non-maleficence. This question asks about a core ethical principle. Non-maleficence means do no harm. As an RBT, you have an ethical responsibility to protect your client's physical and psychological safety and avoid causing harm in your practice. Beneficence is doing good. Integrity is honesty. Justice is fairness. The principle of non-maleficence is about actively avoiding harm to your client. Question 19. You are asked to collect data on the time elapsed from when you give the instruction clean up until the client picks up the first toy. What dimension of behavior are you measuring? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer: B. Latency. This question asks about a specific time-based measurement. The phrase time elapsed from when you give the instruction Q until the client picks up the first toy start of behavior measures the time between the presentation of a stimulus, the instruction, and the initiation or start of the behavior. This is the definition of latency. Duration measures how long the cleaning up lasts. Frequency is how many times they pick up. IRT is the time between picking up one toy and picking up the next. Latency is the reaction time between the cue and the action. Question 20. When thinning a reinforcement schedule after a skill has been learned, you are making the behavior A. Easier to perform. B. Less resistant to extinction. C. More resistant to extinction. D. More dependent on prompts. Answer: C. More resistant to extinction. This question asks about the purpose of thinning. Once a behavior is learned using continuous reinforcement, reinforcing every time, the schedule is gradually thinned, moved to intermittent reinforcement, reinforcing only sometimes. This process makes the behavior more durable and less likely to stop quickly if reinforcement is temporarily unavailable. The behavior becomes more resistant to extinction. Intermittent reinforcement helps the behavior stick around even without a reward every single time. Question 21. What is the ethical responsibility of an RBT if they are unsure how to implement a specific procedure in a client's behavior plan? A. Implement the procedure to the best of their ability and ask for feedback later. B. Skip the procedure until they can observe another RBT doing it. C. Ask the client's parent for clarification on the procedure. D. Contact their supervising BCBA or BCABA for training and clarification before implementing the procedure. Answer: D. Contact their supervising BCBA or BCABA for training and clarification before implementing the procedure. This question addresses a critical ethical responsibility: working within your competence and seeking supervision when needed. If you are unsure how to implement any part of a client's plan, you must seek guidance and training from your supervisor before attempting it. Implementing it incorrectly: A. Skipping it. B. Or asking a parent. C. Are inappropriate and could negatively impact the client's progress or safety. Your supervisor is the expert responsible for your training and the plan's implementation fidelity. Question 22. Which measurement method is typically most appropriate for tracking a behavior that occurs at a very low rate, example 1 to 2 times per day? A. Partial interval recording. B. Whole interval recording. C. Frequency. Count. D. Duration. Answer: C. Frequency. Count. This question asks you to choose the best measurement method for a low-rate behavior. For behaviors that don't happen very often, simply counting every time the behavior occurs, frequency, is the most accurate and direct way to measure its occurrence. Interval recording methods, A and B, are less precise for low-frequency behaviors and might miss instances. Duration measures how long, not how often. When a behavior is rare, just count every time it happens. Question 23. What is the ethical principle related to promoting the client's welfare and working for their benefit? A. Autonomy. B. Justice. C. Beneficence. D. Fidelity. Answer: C. Beneficence. This question asks about an ethical principle focused on doing good. Beneficence means acting in the best interest of the client and promoting their well-being. It involves choosing effective, evidence-based interventions that will lead to positive outcomes and improve their quality of life. Autonomy is about choice. Justice is about fairness. Fidelity is trustworthiness. Beneficence is about actively working to benefit the client. Question 24. You are teaching a client to follow multiple step instructions. Example: get the ball and put it on the table. This is an example of teaching skills within A. Discrete trial. B. Chained skill. C. Response generalization. D. Tact program. Answer: B. Chained skill. This question describes a skill that involves a sequence of responses linked together. Following a multi-step instruction requires performing a series of actions in a specific order. Getting the ball, then putting it on the table. This linked sequence of behaviors is a form of a chained skill, taught using chaining procedures or within more complex teaching frameworks. A discrete trial is a single teaching unit. Response generalization is performing different behaviors that serve the same function. A tact program teaches labeling. Following multi-step directions involves performing a chain of behaviors. Question 25. If a client sees a picture of a cat and says cat, labeling, and the consequence is praise, what type of verbal behavior is cat? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer: B. Tact. This question asks you to identify a type of verbal behavior based on the antecedent and consequence. The antecedent is seeing a nonverbal stimulus, the picture of a cat. The behavior is saying the corresponding label, cat. The consequence is praise, a generalized conditioned reinforcer. When a verbal response is evoked by a nonverbal stimulus in the environment and reinforced by generalized praise, it's a tact. Mand is requesting, evoked by an MO. Echoic is repeating, evoked by a verbal model. Intraverbal is conversational, evoked by a verbal stimulus. Labeling something you perceive is a tact. Question 26. What is the purpose of conducting a skill acquisition assessment? A. To identify challenging behaviors. B. To determine client preferences. C. To identify what skills the client has and what skills need to be taught. D. To analyze the function of challenging behaviors. Answer: C. To identify what skills the client has and what skills need to be taught. This question asks about the goal of a skill assessment. Skill acquisition assessments, like VBMAPP, ABLSR, or simple probes, are conducted to evaluate a client's current abilities and deficits across various skill domains, example communication, social skills, daily living, academic. This information helps the supervisor determine what skills the client has already mastered and what skills should be prioritized for teaching. They are not for finding challenging behaviors. A. Preferences. B. Or functions. D. Skill assessments tell you what the client can do and what they need to learn. Question 27. When documenting a session, objective language means: A. Describing the client's behavior based on your personal feelings. B. Describing the client's behavior in a way that is observable and measurable. C. Using complex technical ABA terms. D. Only documenting successful trials. Answer: B. Describing the client's behavior in a way that is observable and measurable. This question asks about the meaning of objective language in documentation. Objective language in ABA means describing exactly what you saw and heard happening, using terms that are observable, can be witnessed, and measurable, can be counted or timed. This avoids personal interpretations or feelings. A. While technical terms might be used, C. They aren't the definition of objectivity. Documenting only successes. D. Is inaccurate and unethical. Objective language ensures factual and reliable documentation. Question 28. If a previously reinforced behavior is no longer reinforced and its occurrence decreases over time, the process is called: A. Punishment. B. Reinforcement. C. Extinction. D. Spontaneous recovery. Answer: C. Extinction. This question asks for the term used when a behavior decreases because its usual payoff is removed. When you stop providing the reinforcement that was previously maintaining a behavior, and as a result, the behavior decreases in frequency, it is called extinction. Punishment decreases behavior by adding something aversive or removing something pleasant. Reinforcement increases behavior. Spontaneous recovery is a temporary re-emergence of the behavior after extinction. Extinction is letting the behavior fade away by removing its fuel. Question 29. What is the main purpose of pairing yourself with reinforcement when starting with a new client? A. To become the only person who delivers reinforcement. B. To make yourself a conditioned punisher. C. To establish yourself as a conditioned reinforcer and build a positive relationship, rapport. D. To make the client immediately compliant with all instructions. Answer: C. To establish yourself as a conditioned reinforcer and build a positive relationship, rapport. This question asks about the goal of pairing. Pairing involves associating yourself with highly preferred items and activities so that your presence and interactions become reinforcing to the client. This makes you a conditioned reinforcer and helps build a positive relationship or rapport. A strong positive relationship is essential for effective teaching and therapy. It's not about controlling all reinforcement, A. Becoming a punisher, B. Or ensuring immediate compliance, D. Pairing is about building a positive connection. Question 30. What is the ethical responsibility of an RBT regarding maintaining client records? A. Maintain records indefinitely. B. Store records securely to protect confidentiality. C. Allow family members access to records upon request. D. Destroy records immediately after the case is closed. Answer: B. Store records securely to protect confidentiality. This question addresses the ethical handling of confidential client documentation. RBTs are responsible for ensuring that all client records, including session notes and data sheets, are stored securely to protect the client's privacy and confidentiality. Records must be maintained for a certain period according to legal and ethical guidelines, not indefinitely, A, or destroyed immediately. D. Access is typically limited to authorized individuals, so requires proper procedures and authorization. Protecting the security of client information is paramount. Question 31. If a client engages in screening behavior that is maintained by gaining access to a preferred item or activity, what is the likely function? A. Attention. B. Escape. C. Access to tangibles/activities. D. Automatic reinforcement. Answer: C. Access to tangibles/activities. This question asks for the function of behavior. The clue is maintained by gaining access to a preferred item or activity. When a behavior is reinforced because it results in getting a desired item or activity, its function is access to tangibles/activities. Attention is getting social interaction. Escape is getting away from something. Automatic reinforcement is internal. If screaming gets them the toy or snack they want, it's access. Question 32. When teaching a new skill, if you are reinforcing closer and closer approximations to the final target behavior, this procedure is called A. Chaining. B. Generalization. C. Shaping. D. Discrimination. Answer: C. Shaping. This question asks about building a new behavior gradually. Shaping is the process of reinforcing successive approximations to a target behavior. You start by reinforcing any behavior that is somewhat similar to the target behavior, and then gradually require responses that are closer and closer to the final desired behavior to earn reinforcement. Chaining links steps together. Generalization is using skills in new settings. Discrimination is telling stimuli apart. Shaping is like sculpting a behavior. You reinforce little improvements until you get the final form. Question 33. What is the most appropriate response if a client's behavior causes a minor injury to the RBT example, a scratch but no skin break? A. Stop the session and go home. B. Continue the session and ignore the injury. C. Ensure immediate safety. Apply first aid if needed. Document the incident according to policy, and report to your supervisor as soon as possible. D. Implement a punishment procedure for the behavior. Answer: C. Ensure immediate safety. Apply first aid if needed. Document the incident according to policy, and report to your supervisor as soon as possible. This question addresses responding to RBT injury. Your immediate priorities are safety and first aid for yourself if needed. Even if the injury is minor, you must document the incident thoroughly according to your company's policies and report it to your supervisor promptly. This is important for safety protocols, analysis of the behavior, and potential incident reporting requirements. Stopping the session. A. Depends on the severity and policy. Ignoring. B. Or implementing punishment. D. Are not appropriate responses to your own injury. Ensure safety, document and report the injury to your supervisor. Question 34. What is the purpose of using a prompt delay procedure? A. To delay reinforcement delivery to the client. B. To give the client an opportunity to respond independently before a prompt is given. C. To increase the intertrial interval between teaching trials. D. To allow the RBT time to record data after a response. Answer: B. To give the client an opportunity to respond independently before a prompt is given. This question asks about a specific prompting strategy. A prompt delay is an intentional waiting period between the delivery of the instruction, SD, and the delivery of a prompt. The purpose is to provide the client with a window of opportunity to respond correctly on their own before any help is offered. This helps fade prompts and encourages the behavior to come under the control of the natural cue. Waiting for reinforcement, A, is reinforcement delay, increasing ITI. C is for data recording/transition. Waiting for data, D, happens after the response. Prompt delay gives the client a chance to respond independently. Question 35. When collecting baseline data on a client's ability to follow a specific instruction, example, touch nose, before starting a teaching program, what should you do if the client responds correctly? A. Provide reinforcement immediately. B. Provide a different, less preferred reinforcer. C. Mark the response as correct, but do not provide reinforcement. D. Provide a prompt for the next trial. Answer: C. Mark the response as correct, but do not provide reinforcement. This question asks how to handle correct responses during baseline data collection for a skill acquisition program. The purpose of baseline is to see what the client can do independently before intervention. To get an accurate measure of their current skill level without the influence of planned reinforcement, you typically do not reinforce correct responses during a pure baseline probe. You simply record whether they responded correctly or incorrectly. Reinforcement, B, is part of the teaching phase, not baseline. Prompting, D, also happens during teaching. Baseline is just testing what they can do now, without teaching or reinforcing. Just record the correct answer and move on.